And I do fear that this issue could see us sleepwalk into a deepening workforce crisis in the NHS and could result in consultants leaving the NHS early when they still have the skills and experience we need. These individuals are important not just for patients, but for junior doctors in terms of the training and mentoring they receive on the job. The BMA firmly believe that long-term changes are required to the pensions taxation system in order to remove the disincentives that exist, and I would certainly agree with that. The Commons Library's excellent briefing on pensions taxation makes reference to the impact of changes in the annual allowance on the public sector, and notes that in its 2017 report, the Doctors and Dentists Review Body requested more evidence about the impact of the annual allowance and lifetime allowance on early departure rates. The Treasury indicated it would consider revisions to the NHS Pension Scheme if there was evidence that the number of doctors and dentists taking early retirement as a result of its inflexibility was substantial. So I would like to ask the Minister a series of questions, and I appreciate that she might not be able to cover them all today, and a number of them do fall within the remit of the Treasury, but hopefully she'll be able to take those away and arrange for either herself or a Treasury Minister to get back to me. Firstly, what discussions were had by the Treasury with the Department of Health when the tapered annual allowance was introduced, and was this ever flagged as a potential problem? Secondly, what evidence has the Treasury collected on the number of doctors and dentists taking early retirement following the 2017 report? If the answer is none, why is that the case? And when will analysis of the impact on changes to the lifetime and annual allowances on the NHS be carried out? If evidence has been collected, what were the findings of that analysis, and are there any changes being considered? Thirdly, what consideration has the Treasury given to a review of the annual allowance taper more generally, perhaps as part of a wider review into simplifying the incredibly complex system of reliefs and allowances in the UK pension system? And finally, have there been any discussions by the relevant government departments with the relevant parties on whether permitting more individual flexibility within the NHS pension scheme could be a solution? That's something that's being called for by NHS employers. Whilst this issue is not specific to the NHS, and I've already heard in recent days from armed forces personnel, for example, it does appear to be an area with a particular problem. And whilst I appreciate many will not hold great swathes of sympathy for individuals on such high earnings, and who will still be getting very strong levels of retirement pension most of our constituents could only dream of, the reality is if this results in much needed expertise of consultants turning down work or leaving the NHS altogether, that will have major implications for the provision of services and the quality of care our constituents right across the UK receive, whichever colour of government is in control of their NHS. Now, I'm sure that the Treasury did not intend these changes to force experienced, committed consultants, surgeons and GPs to do less work for the NHS, but this is the reality being faced within the hospitals that serve my constituents and, I'm sure, the Ministers. It is good that the BMA and NHS employers recognise this as a serious concern and met last week to discuss, but they haven't agreed a solution or a joint action plan, and in reality the ball is in the Treasury's court. And I absolutely respect and agree with the Government's position that we need to get the balance right between encouraging saving and managing government finances, but I don't think that this is an issue that can just be easily ignored. Legitimate aims to restrict tax perks for the wealthiest in society are exposing ever-increasing numbers of long-serving and highly experienced NHS workers to massive tax charges. If we want high-quality care in the NHS in Scotland and across the UK, we need senior doctors who have devoted their professional lives to the care and well-being of our constituents. It is ludicrous if we face a situation where the pension system is acting as a disincentive and effectively forcing consultants to choose between working for nothing and patient care. I hope that this debate